Welcome to the Foot Health Facts Podcast, powered by the American College of Foot and Ankle Surgeons. I'm your host and a fellow of the college, Dr. Matthew Dairman. In the final part of our heel pain series, I'm back with Dr. Michael Kelly to talk about something most patients try to avoid, surgery. But sometimes it's the step that finally gets them moving again. Welcome back, Mike. Good to have you.
Thanks for having me back.
Surgery isn't the first move for heel pain, but when does it become the right one?
When all forms or most forms of conservative treatment have failed and patients are still experiencing pain that's restricting them from day-to-day activities, from work, from sports, or leisure activities. When there is essentially nothing else to do except for cut, then unfortunately that's the next step.
So just to review, conservative care is typically some form of arch support, maybe a custom orthotic, maybe some physical therapy, steroid injections, anti-inflammatories, stretching, certainly. If all of those things fail after 6 months or so, surgery becomes the answer, right?
Correct. Yeah. So again, it's back when the conservative treatments are beginning to fail, or for example, say it's working, patient comes in for an injection and they don't come back for 6 months, give them an injection. Then they come back 4 months later and maybe we give them another injection, change things up, look at their orthotics. Maybe we're going from an over-the-counter orthotic to a custom orthotic. When those time intervals between appointments become less and less and the treatment just isn't adequate, that's when I'm moving forward with surgical discussions.
So at what point are you obtaining like advanced imaging, ultrasound, MRI, and what do you look for that tells you that surgery might be needed?
Sure. Typically, I start with X-rays and then most often move to an MRI. Sometimes a CT scan, as it can help further investigate the problem, particularly for plantar fasciitis. It may be tearing or severe thickening of the ligament.
Can you walk us through a typical heel plantar fasciitis type surgery? Is it as scary as people think? What's the recovery look like?
Again, every physician is going to have probably a slightly different protocol. I actually have my patients non-weight bearing in a cast or a splint for 1 week, and then I have them walk in a boot for 2 weeks, and then they're back into shoes in 2 weeks, or sorry, in the third week.
Gosh, we can have a whole podcast on different aspects of heel surgery. I walk mine immediately. If it's straight heel pain, they're out of the boot within 2 weeks, typically. If it's also addressing kind of the gastrocnemius, they're out in 3 weeks. But there's so many different approaches to it that I guess once you get to this point, you just have to.
Sure. And I went through processes where I let patients walk. And I think with these surgeries, the reason that I splint is I want to prevent that fibrosis or that reattachment back to the fascia or to the gastroc. And what I have found is that some people actually become more conservative, and when you tell them to walk, they don't. And it's kind of for that reason that I've put patients in the splint or the boot and have them non-weight bearing, because I think that they are typically more likely to be compliant with that than letting them walk a little bit more right after surgery, which is what I would want them to do. But if they're having some surgical pain, which is certainly possible, they tend to not walk as much as I would like them to do.
Yeah, what I've done is since all these patients have failed conservative care in my practice typically involves some form of night splint that they're used to wearing. So after the surgery, if they don't want to sleep in a boot, for instance, I just have them put back what they're used to wearing. How do you help people and patients set realistic expectations, especially those who want to get back to being active?
Particularly when someone has undergone a surgical procedure, you have to understand that there is going to be a period of potential post-surgical pain and swelling, but your foot and ankle surgeons will have strategies to help mitigate this. Recovery is always going to be variable based off the condition being treated and the protocol that your surgeon has for that recovery. Some could expect to return into shoes, as we've discussed, as early as 2 to 4 weeks. Others, some could be extended and maybe up to 12 weeks. The more extensive surgeries typically require longer initial periods of mobilization. Oftentimes after surgery, I do have patients start physical therapy. So I think with appropriate guidance and sometimes some manipulation therapies, it can really help them get back to sports and activity a lot quicker.
Yeah, absolutely. And it's important for people to understand that surgery is not a guarantee of success. And I tell all of my patients, whether it's for plantar fasciitis surgery or some other type of foot and ankle procedure, it can take up to 6 months before they forget they had foot surgery for any number of reasons that may or may not be related directly to the procedure at hand.
Yeah, but I tell patients is where you are 1 year after surgery. Unfortunately, sometimes if there are some, little pains or some numbness, tingling, some swelling during the course of recovery, a lot of that stuff is normal. But when you're at 1 year and people are still experiencing that, it's unlikely to go away without some other types of interventions, potentially repeat surgery.
Yeah. So if someone's been pushing through pain for months and is scared of surgery, what do you want them to hear today?
So there is a solution out there for you, and you need to find a podiatric foot and ankle surgeon near you. They are the leading experts in foot and ankle care. They have more education and training in the foot and ankle than any other healthcare provider. They treat all conditions affecting the foot and the ankle, from simple to complex, in patients of all ages, including heel pain. Their intensive education and training qualify foot and ankle surgeons to perform a wide range of surgeries, including surgery that may be indicated for heel pain. So don't wait. Don't use the internet. Go find a local provider for you and let them help you get there. As we've alluded to earlier in the podcast, particularly with heel surgery, it happens in probably less than 5% of patients. And the vast majority of the time, it can be treated with conservative care. But it's important to buy in to the treatment and understand why each approach is going to be helpful for you.
Yeah, plantar fasciitis is not something you have to live with. I can't tell you how many times I've seen patients say, "Oh, I've had it for years." Well, it might be plantar fasciitis, but if it's been there for years and it hasn't been addressed appropriately, or maybe it has been addressed appropriately, it's probably not plantar fasciitis at that point. All right. Well, thank you, Dr. Kelly, for your time and expertise. Would love to have you back sometime. Maybe we can talk about getting into more depth on heel surgery and various approaches for it. Share what we do every day as foot and ankle surgeons. Thank you for your time.
Thank you. Appreciate you having me.
You've been listening to the Foot Health Facts podcast. For more information on today's topic or any foot and ankle concern, head over to foothealthfacts.org. Remember, there are many causes of heel pain. It's always best to seek help from a physician sooner than later, because the longer you wait, the longer it takes to heal. On behalf of the college, I'm Dr. Matthew Dairman. Thanks for joining us today. If you enjoyed this episode, don't forget to like, subscribe, and share it with someone you care about. Together, we'll keep everyone moving forward, one step and one topic at a time.